So we're going to discuss peripheral neuropathies, and peripheral neuropathies could actually be discussed so easily, and you just have to go this way. So anytime you hear anything, any word, you try to break it down. So when you say peripheral, it simply means the thing is on the outside. It's outside the central nervous system. Okay. When you say neuropathies, of course, it's any issue towards the nerves. Any issue to the nerves. Okay. So peripheral neuropathy. So peripheral neuropathy, you just have to do with disorders that affect the peripheral nerves, which is the network outside the brain and spinal cord. Okay. Alright. And it carries sensory motor nerves, autonomic nerves, signals. So types of peripheral neuropathy: we have the sensory neuropathy, we have the motor neuropathy, we have the autonomic neuropathy, we have the mixed neuropathy, where you could have a combination of issues there. So common causes could be metabolic issues like an underlying diabetes, could be nutritional issues like vitamin B12 deficiency, could be alcoholism, toxicities like chemotherapies, drugs, heavy metals, infections like HIV, leprosy, Lyme disease, autoimmune issues like all those Guillain-Barré syndrome, chronic inflammatory demyelinating polyneuropathy, then hereditary, where you're having all those Charcot-Marie tooth, traumatic carpal tunnel syndrome, nerve injuries. Okay, so clinical features is numbness and also tingling. Okay. And motor symptoms like you're not able to move that part of the body again because signals are not reaching it. Okay, so autonomic issues like orthostatic hypertension, abnormal swelling, bladder and bowel dysfunction. Then pattern is often a stocking glove distribution. So a diagnosis from clinical examination, electrodiagnostic surgeries, like all those nerve conduction studies, electromyography, lab tests to now see the levels of all those glucose, vitamins, autoimmune markers, infectious serologies. Then you can also image and also take some biopsies if needed. So management, you control any underlying issue. So if you're having all those diabetes, control it. Correct vitamin deficiency, stop the offending drug. Okay, so symptomatic relief, that's all those pain management, gabapentin, physical therapies, orthotics for weakness. Okay, then prevent any complications.